to do a very hard disease because they have more energy, right?
What do you mean?
I mean, men can transmit more energy. Does that mean that they
You
can
think?
heal more?
I don't know about that. I was talking to someone, a friend of mine, who also teaches yoga, and he knows about Nam yoga, and I was talking about how I feel so gentle, and I have this soft energy, and he was just reminding me that the feminine energy is very powerful.
It is?
And it's probably more powerful than the male. The male has a kind of a linear thrust to it, but the female is almost like the bowl and the receptacle, like the womb. So it has an emptiness, but without the bowl, you cannot have all the fruit inside the bowl. Oh. So all the fruit would just disappear. So even though it appears that the male energy is stronger
because they have more muscle,
the more
they can dissipate it.
The woman's restraint and the woman's gentleness and grace and ability to even give birth. I mean, men are probably jealous of that. And when we talk about male and female energy, I mean, there's the actual female, I'm a female, and then there's the male, but there's also, I believe, I have a male energy, and men have female energy. And it's about keeping that in balance and finding that equilibrium. And that's why we chant like Rama to balance the Ra, the sun.
Oh, that's the music you play while you do the harmonium?
Sometimes I play this, sometimes I play other ones. And this is very important. It's part of the healing session.
Who's doing this music?
This is also Dr. Joseph Michael Levery.
That's him?
That's him.
That's him playing?
Well, I'm sure there are other musicians.
No, I mean...
But yes, his voice.
That's his voice. Okay.
Yes.
And he is in New York.
He travels a lot. Right now, I think he's in New York. He was just in India, and he's in New York, and he travels.
Can you describe him? How old is he?
He doesn't tell his age. We have to keep our secrets like a woman. You don't tell your age after a certain point. You gotta, keep the...
But he's a mature man.
Mature. Yes, he's an older man with much experience, and he's funny. I think he has a really great sense of humor. If ever you come to his class, which you've done, you sense his playfulness.
He should come to California, maybe.
He actually is. In Santa Monica, we have a Nam Yoga Center opening.
Oh, so you might go visit him?
Oh, absolutely. I'm actually going to LA next weekend for
So you might call him?
Yeah, let's go get sushi. No, but I am going. This Nam Yoga Center in Santa Monica is opening in a few months. It's actually it's right near the water. It's
There's
on,
a lot
I think,
of
4th
interest now in
Street.
California for that kind of
Absolutely. My friend Phoebe's, I've given her harmonium, or I've given her Nam sessions. She had an eye surgery, and she really felt the healing energy of Nam Yoga. So
you did it on her?
I think we just did some classes, and we did a lot of chanting of Lumen Illuminate.
And
she really loved it, and she felt it. She was going through a lot of healing herself. So there's a lot of interest in Nam Yoga and Harmonium in LA. They have classes on the beach.
Yeah.
If you go to universalforceyoga.com, they have schedules of the classes in the LA area.
So you might go level 2 next time?
For Harmonium,
2.
I do want to go and do the Harmonium 3, and I think every year and a half you need to
upgrade.
You need to go to a course to make sure that you're updated.
Okay.
So it's been about a year and a half for me. So I'm due for a touch-up.
Continuing education.
Yes, exactly. Continuing education, exactly.
Okay, and. Are people in San Francisco aware that harmonium exists? Because each time I tell someone that you do harmonium, they say, "What is that?" So you need to educate people about it, I guess.
Yes, I think awareness is the first step. A lot of people have heard of harmonium, but it's actually a musical instrument. Really? So people say, "Oh, you play the harmonium? That's totally awesome."
Yeah.
And then I'm like, "Oh, I'm actually it's something a little different." But
is it something that you could possibly offer to sick people in a hospital?
That's a great question. And in fact, that's a really perfect way to offer it. It's for people who maybe can't go to class. So it's really great for people who are in a hospital, who just had surgery.
They are your perfect clients?
They are. I've given harmonium to women who just gave birth, and they're really not up to
so
doing
that's
that.
Where
it's
your
also really
are.
good for people who cannot maybe
do it on their own.
do it on their own. I mean, I've given it to premature babies, to people in the hospital. It's really great. Also, people who maybe just are mourning someone, who have jet lag, who are depressed, who maybe aren't.
They
need
Extra
external
energy.
energy from an outside source to re-get the cycle of healing
normal.
going on. So that's a really great application of a harmonium.
Yeah, true. But are you scientifically allowed to go to a hospital, or you have to do it on the boundaries of the hospital?
I think you're allowed as long as the client, the person that you're giving it to, gives you the okay. So,
Yeah.
for example, when I went to the hospital for the premature babies, the mother said
Go for it.
I filled a
Sign.
guest,
Okay.
I was a guest pass, what have
Yeah.
you, and then I went in and I gave that session. So it's like you're a guest, and obviously the person that you're giving it to has to, or the guardian or the person that's
Yeah,
responsible
but
for
the
the person.
people in the hospital might not know that you exist. I mean, you have to let them know you exist, just like all the doctors center in the hospital, so they know that's where all the doctors are. Where can people find you? That's the question. Can you be part of a group of healers where people say, oh, here's another type of healing you can try?
Well, in San Francisco, we have my friend Leslie Schickel has a group called Adaptogen.
Yeah.
So every second Sunday of the month, we have a group of different healers. It could be Reiki, massage.
Oh, you get together?
Tarot. I've given a
And
couple.
people choose what they want?
Yeah, it's a salon. So and it's all by donation. So you go in. It's between $10 and $100, I believe, and you get 20-minute sessions. But most practitioners go over, so you actually
Yeah.
get a full session.
Okay.
And then there's food, there's a guest speaker, there's
people
tea by Om
get to
Shanti,
know.
who has
So
the
you
cafe.
bring awareness to...
Absolutely, and that's a great place to learn about the different healing modalities, and a way for different healers to have an exchange with one another. And that's at Twin Space in the Mission. So people in the Bay Area who want to learn more about healing and Harmonium can contact Adaptogen, probably adaptogen.com or Google
How about
that.
Rootlight? Rootlight?
Rootlight.com is a really wonderful website for
Finding the healers?
finding about information about what is Nam Yoga, what is
Harmonium.
Universal Kabbalah, what is Harmonium, and to listen to this music, to order the music, the literature I mentioned, Lifting the Veil, and also there is a great section with all of the
Yeah.
all of the what are they called? The when someone writes something and it's like
Oh,
two
yeah.
pages. He writes little
Testimonials?
not testimonials. He writes it's like every couple months he'll write a newsletter. So there's these newsletters. So if you want to get a sense of
You can advertise in the newsletter?
no, I think he just wants to. He has a theme, like he'll talk about the body of pain, or he'll talk about different things. And I really enjoy that section of the website. There's also a section.
Is there such a hospital that would hire a harmonium healer? No, they hire only medical scientific doctors, right?
With time,
They might.
and maybe somewhere there are hospitals that hire harmonium treatments. I wonder, do hospitals have massage therapists that they hire?
Yeah.
Or do they just out-clinic them and pay
No,
the insurance
I mean, they have
pays it
people
back?
on call. They have people
They
on
do. Well, that's a good thing to do. So,
call. Get in touch with the HR and say, I'm on call. Yeah, something like that.
that is a good idea. Yeah, you could probably put up a little pamphlet and then write all the hospitals and say, hi, this is what I do. And we
help
need
it.
more research,
More awareness.
awareness.
Or you can give workshops and give educational, informational workshop to inform patients about what it is, and then it's up to them if they wanted to.
That's good. That's a good idea. I went to the I think it's the
JCC?
not the JCC. There's this. They're opening more and more buildings along Geary. It's the Institute on Aging. Do you
Yeah.
know that place?
Yeah. Well, so
So I did talk to them, and they, I guess, I guess because you're dealing in a hospital setting, I don't. They were really into having training with dealing with people who are dying.
Okay.
So
that's a little bit too hard on you.
I would say, I've had roommates in college, and one of them, who's really sweet, David, he did the hospice program, and that's when you volunteer and you work with people who are dying. And he said it was really, really challenging, but it was so rewarding and wonderful. And he said, I really recommend that you do that.
Yeah, my friend who took the massage school for 8 months, then at the end she was required to do 2 weekends in the hospice.
Really?
So, but
and how did she feel?
She did it as part of the curriculum.
And did she feel it was?
It's okay.
It's okay.
Yeah.
Yeah, I know. They have a. Guru Nam Joseph Michael Every is teaching Nam Level 3 in 2 weekends in New York. And so this is for people who are already very much advanced, like teachers like myself. And I'm kind of like, I want to go, but part of the weekend is on helping people who are dying. And I feel
you don't wanna go,
I don't want to go because I'm very much don't want to. That's not something I'm attracted to it now.
So it's not your time.
Maybe it's not my time.
Yeah, maybe
because.
Yeah, there's a time for everything, like they say.
Yes.
And this is not for you right now. Maybe you're too much into something happy and like maybe birth and babies and stuff like that.
I do like babies and birth.
Yeah.
But
just like my sister, she would rather work in the gynecology department than work in the cancer department because as she come home, she doesn't have to feed births as a nurse, So you pick the department you prefer.
But but maybe like your friend who did the massage school, she had to do 2 weekends. So maybe it's something that, even if it's something you don't want to do, you have to have like a minimum just
so that in case.
Well, even say at some point a client's going to have a friend who's going through something, or it's going to cross your path at some point. So even if you don't want to go out and actively do it, you need to have the minimum
it's in your
to deal
training.
with it. So maybe I'll go. So somebody asked me, are you going? I was like, I don't know. And it's like 2 weeks away.
You can think about it, right?
I can think about it, exactly.
Yeah.
Like, God willing, let thy will be done.
So Jenny, I think you shed a lot of light on us.
Thank you.
And
thank you for having me again.
Well, this is my pleasure, and I hope that you'll be, along your career, able to heal a lot of people, and that's the satisfaction of it when you do see some results.
First of all, I don't want to say I'm healing anyone because I just need to be humble and really.
It's God who's doing it. Yeah.
It is God who's doing it, and I'm just a channel of allowing the light to pass through me and just let it go afterwards. I think that's something that allows you to be a better conduit for the light.
Okay.
And so I just want to first and foremost say that, and secondly, of course, seeing
some progress.
Progress is inevitable.
Okay.
So that's very much beautiful. And I just want to mention, just like you said, you didn't enjoy it at first, and I didn't enjoy it at first. And a lot of times people don't come back for a second session. And I think it's so important to come, give it a shot. Give it a shot. That's why we say 7, because not every session is the same.
Okay.
And you really can feel some very powerful and healing and insightful things. Maybe not during the session, maybe your sleep and your dreams are illuminating, and things that'll change your life.
Okay.
Completely change your life. Okay. Better awareness.
So that's a good point. That's a good point.
So I just want to tell
people.
That's
why he advised 7. Yeah.
That's part of it.
Okay.
That's part of it.
Okay.
Thank you so much.
Yeah. Thank you, Jenny. It has been a pleasure. So I'll try to do it the second time.
There you go. There you go.
Thank you.